Hello everyone. Now in this video I will be discussing about the history taking of a diabetic patient. L- Like when a diabetic patient comes to the clinic, what questions to be asked and how to take a history. So here are the questions which are to be asked for the diabetic patient. So for how long time have you been suffering from diabetes, and what was your age when the diabetes was diagnosed, and when diabetes was diagnosed then which symptoms were present at that time. Okay, is your diabetes controlled or not, and what are the usual fasting blood glucose levels, and what are the usual blood glucose levels after 2 hours of the meal, and do you perform your 3 months blood glucose test, which is also called as HbA1c. What are the values last time, and do you check your blood cholesterol levels on the regular basis, and what is the value last time, and currently what medications you're taking for the diabetes, and when diabetes was diagnosed then which medications was started at that time. So if the patient already taking insulin, then we have to ask the following questions, like which type of insulin you are injecting, and and how many times do you inject insulin in one day, and can you tell me about the units of insulin which you are injecting. Can you inject the insulin by yourself or do you need help? Do you take medications regularly or not? Is there any history of hypoglycemia in the past? Did you ever admit to the hospital with the uncontrolled blood glucose levels? Is there any past medical history of heart attack or stroke? Do you feel pain in your lower limbs while walking? Can you distinguish between the hot and cold? Do you ever feel palpitations? Do you feel dizziness while standing? After a diagnosis of diabetes, do you feel any difficulty in relationship with your partner? Do you feel any difficulty in passing the urine? Any frothing and bubbles in your urine? Do you have hypertension? Do you have ulcers on your feet or not? Is there any history of high blood glucose levels during the pregnancy? Do you perform the exercise or not? Do you take a healthy diet? If the patient is pregnant, if the patient is female and she is pregnant, we need to ask, is there any history of high blood glucose levels during the pregnancy or not? Okay.